Ex-Lax tablets are an over-the-counter medication used to relieve occasional constipation. They are designed to provide short-term relief and should not be used for an extended period without medical supervision. Ex-Lax tablets contains bisacodil as the active substance. Bisacodil is a stimulant laxative that works by stimulating the intestines to promote bowel movements. Indications: Ex-Lax tablets are indicated for the relief of occasional constipation and to help reduce bowel movements in individuals experiencing difficulty passing stools. How to use: Take Ex-Lax tablets orally with a full glass of water. The usual added dosage is 1 to 3 tablets taken at bedtime or as directed by a healthcare professional. For children 6 to 12 years old, the recommended dosage is 1 tablet at bedtime or as directed by a healthcare professional. Children under 6 years old should not use Ex-Lax tablets unless directed by a healthcare professional. Contraindications: Don't use Ex-Lax tablets if you are allergic to bisacodil or any ingredients in the product. Avoid Ex-Lax tablets if you have certain medical conditions such as intestinal blockage, severe abdominal pain, or acute inflammatory bowel disease. Special instructions: Ex-Lax is for short-term use only. Don't use it for more than a week without consulting a healthcare professional. If you do not have a bowel movement after using Ex-Lax or if your symptoms worsen, discontinue use and consult a healthcare professional. Drinking plenty of fluids while using Ex-Lax is essential to prevent dehydration. Side effects: Commonly side effects of Ex-Lax may include stomach cramps, nausea, and diarrhea. Prolonged or excessive use of stimulant laxatives like Ex-Lax may lead to electrolyte imbalance or dependence on laxatives. If you experience severe or persistent abdominal pain, rectal bleeding, or signs of dehydration, seek medical attention.